Hello, good day to everyone. So I am Vanessa Pilapil from BSTM 1B Night, and I am going to demonstrate the treatment procedures. So if you wanted to know and learn the basic first aid treating skills, then you are in the right video. So let's start, and here is my first demonstration. First, treating cuts. Before I'll start, so cut and scrapes is definitely the most common injury, so it's good to know how to treat it easily. First, clean wound, either medical wipe or soap and water is available. And after washing the wound, pat it with a dry cloth and then apply a antibiotic ointment, and after this, follow up with a dry sterilized dressing or a commonly called as a band-aid. This will allow the wound to heal itself and prevent infection. So blasters, they are the bubbles that pop up when a fluid collages in a pocket under the top layer of your skin. So the first thing you should do, cover the affected area with a piece of moleskin. If the blaster is going to the burst and if it leaves, do your work condition, drain fluid using the sterilized pin. After it, put a bandage. So normally to without putting yourself at rest for infection. Burns are the common injury in cooking or operating around any other source of heat. First-degree burn is typically only a reddening of skin and mild irritation to treat this kind of burn. So simply run the burn under the cold water or apply a cold wet rag until the pain goes away. So, further information, never apply ice to a burn. Second-degree burn are typically signified by blasters forming as the damage has spread the tissue beneath the skin. For treatment, submerge the burning water or apply a cool wet cloth until the pain goes away, and then cover it with sterilized gauze pad, so never try to break any blasters as it could lead to infections. So this is the third-degree burn. When the damage has gone through the skin and the tissue beneath it, the skin will typically be burnt away in the flesh, blackened, and the burn may be so deep that the victim's nerve endings scored that they feel no pain. So call 911 immediately if a victim has a 3-degree burn, and don't try to remove any clothing. It could be fused with the skin rather. If this will happen to you, wrap the injury in a clean, dry cloth and treat for shock until help arrives. Insect bites. So there will be 5 kinds of insect bites that I will demonstrate in this video. If you are bitten by a tick, simply use tweezers to remove it. Grab as close to mouth of the tick as possible and gently pull it until it is freed from your skin. For treatment, first thing to do is wash with the running water or antiseptic, and after that, you need to apply an antibiotic ointment after the removal is complete. If you develop fever symptoms, talk to a doctor as a ticks can lead to Lyme disease. Chigger bites are very small spider-like things that feed on your skin. Chigger bites are almost unnoticeable until after they drop off your skin, so treatment is pretty much just apply lotion to treat the immense itching sensation. Spider bites are very common and most of them are pretty harmless overall, but a few are very large threat to humans, such as that of the black widow or brown recluse. If a victim suffers from swelling, redness, pain, and vomiting or other symptoms, get the medical attention immediately and treat for shock. Hornets, they won't usually sting you, but sometimes the worst happen and they decide to sting you anyway for some reasons. If it sting on your skin, scrape up the stinger with a credit card or a pocket knife and apply an ice pack to reduce swelling. Snake bites can be seriously threatening to a person's life, and while relatively uncommon, you should be able to treat it in a case of an isolated incident. Keep the victim calm and gently wash the wound site and remove any jewelry before the area swells. Resist movement and keep the bite of the approximate level of the hearts. Don't apply ice or take any other actions. Just call 911 and try to get the victim to help as soon as possible. Nosebleeds. So the correct first aid to stop nosebleed is you must think to do is stay calm, because if you start to get nervous, it can actually make you bleed more. So slightly bend your body forward while sitting or standing. Firmly pinch the soft part of the nose just above the nostrils and keep your head above your heart. Breathe through your mouth and hold this position for 5 minutes. If bleeding continues, hold the position for an additional 10 minutes, and if bleeding does not stop, go to the emergency department. If choking happens, stand behind the person that bend them over your forearm. Strike their back between the shoulder 5 times. If this does not clear the way, position your arms around their waist. Make a fist with one hand at grasp with the other hand and perform up to fire abdominal thrust by thrusting your clasped hands inward and upward. And in covering shock, such as clutch airway with the person down and raise the legs about a foot above the rest of the body to move blood to the vital organs. Make sure to keep the victim warm with blankets.
Saturday morning, jumped out of bed.